Hello, welcome to Innovative Health Podcast. I'm your host, Kristen Wilisinovich, and I'm here with my beautiful guest co-host, Joe McAllister.
Good morning.
Good morning. How are you?
Fabulous. How are you?
Doing well. And as always, we are excited to have a handsome gentleman in the Innovative Health Podcast studios. That's right. The actual Dr. Richard Klein, dentist extraordinaire, is in the studio. Hello, Dr. Klein.
Hello.
Hello, and I thought I believed everything you said until you said all of that about me, my gosh.
Do you think that I'm losing credibility now because of the adjectives I added prior to the introduction?
I'm thankful for them, thank you.
You're very welcome, and they are 100% true. So we are so happy to have you here. You are actually a dentist, correct?
That's right. By trade and by my scope of practice, I am a dentist.
How long have you been a dentist?
Oh, longer than you were born. I graduated from the University of Detroit School of Dentistry in 1967, and then I first started practicing dentistry. That was back during the Vietnam War, so I volunteered into the Navy and practiced.
Well, thank you for serving.
Yes.
Yeah, thank you. It was, I learned that the government is wonderful, but they're not as honest sometimes. Yeah, they said, you're going in as an officer. You're going to be anything in the world you want. You can go anywhere you want. Pick three places. And I'm so young and naive.
Right.
I picked Hawaii, Germany, and Japan. And I spent 2 years at Parris Island, South Carolina.
Oh,
Wow. South Carolina's not bad, though.
But
it could have been worse. That's absolutely
that
right.
whole thing about you take lemons and then make lemonade, I love it down there. I learned a lot. I was taking 50, 75 wisdom teeth out a day.
Oh, wow.
They were recruits, all 17 years old. So.
Oh, that's right. So during that age, that's when usually it occurs,
Wisdom
or they're
teeth even?
in. That's right. And you have a very thriving practice, very busy, correct? You had dentists working for you. You had a massive overhead of staff. You were very busy.
I was very busy after I came back to the United States, to Michigan. And unfortunately, but now I look at it not that way at all. I really thank God for this accident. I was on my way back in 1994 to lecture to the Michigan Brain Injury Association about what happens in a car accident. And ironically, my Kodak slides were all over the place because I was rear-ended on the ice of Telegraph and pushed into the car in front of me.
Wow. Pretty ironic.
Well, but I thank God now. I had a couple pretty tough years. I herniated cervical disc, lumbar disc. I had a TMJ problem. I've had 2 total knee surgeries, and I had to quit that practice that you just described. I loved it, but I thank God now because I get more handshakes and hugs than I ever got for doing a good root canal. And I like what I'm doing. I'm taking people, reestablishing their lives to have happiness.
Yes.
And actually with sleep apnea and TMD, I'm actually saving lives. And
Yes.
So the trajectory of your practice took a whole different turn into pain management and TMJ and TMD. Tell us a little bit about both of those acronyms.
All right, TMD. We all have a temporomandibular joint. You've probably heard people say, I have TMJ. We all have TMJ.
Right, I've heard that quite a bit.
Yes.
Right, my whole life.
The name of this joint is temporomandibular joint. To break it down, the lower jaw is the mandible. The mandible hinges in a joint right there,
Okay.
and it's close to the temple. So they named it temple-mandible joint. They couldn't figure another name, so they found out where it was and talked about it. When you have TMD, which is what I treat, that's a disorder of the TM joint. So if you say I have TMJ, you're right.
Everybody does.
Everybody does, like having a knee. You
Right.
can't go to the doctor and
Right.
say, what's your problem? I have knee.
Right.
You have a problem in the knee.
Right.
The other is OSA, obstructive sleep apnea. Now, both of those, if it's not from an accident or for other things that we can talk into later, are based on anatomy. The anatomy of how the jaws fit together and how they support themselves while you're sleeping is what I treat when there's a dysfunction of that anatomy.
And I know, Joe, we talked on a personal level. Your husband, Mark, you believe has some sleep apnea. And
absolutely.
I think sleep apnea, personally,
Scary.
it's scary. And you're probably seeing it as an epidemic.
Yeah.
And people aren't treating it because they don't know unless their spouse or a family member can watch them.
Right. It's not exactly that scary, I don't think, for him because he's sleeping and he just gets
doesn't
disturbed
know.
a little bit and falls back to sleep. But as somebody who witnesses it, it's pretty scary. You know, he catches his breath, he holds his breath for a long time and then catches it. And it's just very scary because he's gasping. And
So how would you treat that, Dr. Klein?
Well, both of these symptoms that I treat, the only two diagnoses I treat are TMD and OSA, are controllable.
That's comforting.
yes.
Very comforting. And now, in your husband's sake, TMD is devastating. People have committed suicide over it in the past until we learn how to treat it. It's very, very painful, but
That's
it's not
what-
going to kill you.
Well, that's what I was going to ask. What are the symptoms? It's just severe pain.
It's life altering, but not life threatening.
That's right, but it's so overwhelming from a pain management side that they just don't know how to control it, correct?
Correct. So I am fortunate now because of all the problems I had and I still had an ability to remember things and talk about things and learn things. So I went back and became board certified in pain, which means I'm not doing teeth anymore. I am doing pain management. I teach it at Michigan State Medical School at St. John Hospitals.
Go green, go white.
We'll see.
Remains to
I'm
be
with
seen.
you on it, but this year we'll see. So basically, pain has a lot of consequences. When someone has been in chronic pain, which could be, for what I treat, TMJ problem could be chronic. If you're chronic pain for your back or your neck, what happens after a couple months, the brain says, this is not a bee sting. This is not a burn on the stove. Those things go away. So when it doesn't go away, the brain is active. It tries to help you out. Everybody knows if a pit bull is chasing you, the brain, through fright and flight, which we learned in high school, it spills out chemicals, so you
Right.
run fast.
Right.
Well, in chronic pain, whether you're a man or a woman, that chronic pain has some deleterious side effects. It makes you act like you're in PMS. Now, the nice thing about PMS is it goes away in a few days.
Sometimes.
Sometimes. I'm sorry. I'm a guy. I just read those things. I don't know how to, I don't feel it.
But to that point, right? I can speak to that. You can speak to that, being a woman, but you can speak to the pain management because you went through it. So it would be maybe a different scenario if you were just a physician who really had an experience. Like, I'll be honest, I do have some minor lower back pain, but I teach spin class. I'm very active in volleyball. And I've been very fortunate, knock on wood, my goodness, as soon as I say something's going to happen, but to not feel that pain. So if I were to become a physician and treat it, I just don't know if I'd really have that empathetic, ability to treat them in a proper fashion where you've been through it. You can do it. So it says a lot. It speaks a lot to what you do and how you, there's a better word. I don't want to say cure, but how you help them, I don't know. You know what I'm saying. I'm never at a loss for words, but I feel it.
But you're right on, which is why I really enjoy what I'm doing now. When my accident happened, it was in 1994, I was halfway through my career. And I realized what anybody out there is in any profession at all that you went to college for, you know this. You learned a lot more the first year out of college than
right.
all those years of college.
That's right.
So here I
Experience.
am. I've got this new thing. I got to work on pain management. I didn't want to wait 10 years to learn it all. So what I did is I looked up all the gurus, people that I read their textbooks, heard their lectures, and some of them were nice enough to sit and talk with me on the phone. A couple were nice enough to let me come and shadow them. So I learned very quickly what could have taken me 10 years to learn. One example, Dr. Janet Travell. I love that woman. She's passed away now. It's a wonderful story. She coined the term trigger point. Now, a trigger point is a hyper-irritable spot in a muscle that refers pain somewhere else. In my field, right here, a cheek muscle, if there's a trigger point, could make the ear hurt, could make the eye hurt, it could make the teeth hurt. People didn't know that.
You don't know.
So when anything new comes on, nobody believes you. So Dr. Travell had two things going terribly wrong for her in the 1950s. One, she found out something that's true, but nobody believed her because it was new. Two, she was a woman in the 1950s.
Right.
So
Well,
nobody
Two
I
believed
strikes
her.
against her.
But I think we struggle with that even in today's world.
Yes.
Oh,
You
yes.
see it. So, yeah.
The reason they didn't take her license away when she published that every muscle has a trigger point and where that trigger point could make something else hurt and was confusing, they thought heresy. Women, you're crazy. They they tried to take her MD license away.
Oh, wow.
The reason they didn't, wonderful story. There was a wealthy family in America who had a son in a lot of pain. Dr. Travell was Senator and then President Kennedy's personal physician. She did not lose her license.
That's absolutely right. I have goosebumps right now because that's a beautiful story.
Yes.
So lucky, I knew she knew a lot, so I went and studied under her, and I learned it really quickly instead of in 10 years.
And I think it's incredible. Oh, sorry, Joe.
No,
real
I was
quick.
just going to say he was proactive too in learning so quickly by putting yourself out there and going to shadow. That says a lot about you.
I had all the basics. I just needed to know how to put them together.
Sure.
I was going to say the same thing, and not just shadow anyone, the best of the best.
Right.
You knew where to go. So that was really incredible. So let's talk too real quick about pain management and the stigma behind it, because now what we're facing, and I don't think you disagree, is an opioid epidemic. And so with pain management comes massive stigma. So how do you handle that? Because to be honest, the opioid epidemic, going back, even talking about in the 1950s, this is new, relatively new to us.
Oh, that was in high school. We didn't see a lot of even marijuana.
That's right. So now you're seeing all these prescription meds, and that's where the problem therein lies. I mean, you talk about marijuana, which now you're seeing all these studies of cannabis and the medicinal effects of it, and how they're treating cancer patients or epilepsy or pain. And now you're looking at all these meds that they're getting prescribed from really a primary care physician or their pain management specialist. And there are those who just cannot handle it. Is that correct? Help me out. You're the subject matter expert. Talk to me about this.
I would like all of my patients to be like you. You already described you have pain in your back. And you also said what you do. I mean, you're active.
Very.
So someone in pain who becomes a couch potato and then they pretend that the pill is going to make me feel so much better.
Right.
Those are the ones that you want to turn into do what you do, and not everyone will.
A body emotion stays in motion.
Oh,
Well, it's
yes, it
blood
does.
flow,
Yes, it
right?
does.
It's the mobility in the
Yes.
blood flow, and
Gotta
that's
keep
what
moving.
sustains life.
It's been proven that good exercise, not excessive, but good exercise on a daily basis is more powerful than taking the pain pills.
Yes.
Doctor-
Even just stretching.
Dr. Klein's coming to spin class. We're going to burn those calories. But I totally concur with you because, having grown up, I was stressed out early on, undergrad from U of M, master's degree. I started experiencing anxiety, panic attacks, anxiety. And, they wanted to go, okay, here's an antidepressant, here's some benzodiazepines, and just go breathe, right?
Right.
And you know what I honestly did, Dr. Klein, is I changed my diet and I started running. I started a lot of cardio, which really helped me. And that's just gone on. And now I'm 25. Wink,
Exercise,
wink.
right.
But I'm saying 20 some years later, it's what has really helped me live a really beautiful life. And
Exercise
I'm very
helps
happy.
so many
Yes.
levels.
So how do you treat that? So when you have patients that you probably have both of the spectrum, right? You have those that are using it properly and moving and mobile, and then you have those that are taking it and using it as a crutch and again sitting on their couches and not moving. So, and you obviously can identify both of those right away, I'm sure.
I try to make up analogies in lay terms so that they understand it.
Thank you. We need that.
Yes.
Third grade.
I don't talk about the serotonin modulation of the neurotransmitters in the thalamus way over most people's heads.
Right. I'm sorry, what is it? It's starts with a D. No, the chemical, the D, the dopamine.
Dopamine.
See how smart I am?
And serotonin and
All of it, yes.
All of it, yeah. So what I mention is that if you stay in pain for a while, you act like you're in PMS. We mentioned that one already. Everybody understands that. It's
For
really
sure.
not like PMS, but the symptoms are. So if I make them a mouthpiece, and we'll get into why that's important, this is a joint. And I let my patients know the joint can heal. But if you sprained an ankle, it can heal. If you rest that ankle all night long, do you run a marathon on it during the day? No. So if you don't wear that orthotic and don't massage and don't stretch and all the things we're going to talk about, if you don't do that, you're going to have that sprained ankle for the rest of your life.
That's right.
So you've got to be proactive or just stay with the pain. It's your choice. If your choice is just to lay on the couch and watch TV and lay at the wrong angle and hurt your neck, you're going to have this forever. if you don't want this kind of pain that you're here for, you have to be proactive. I'm not just going to give you muscle relaxers and pain pills. I'm going to give those to you because you need them right now. But there's a limit. In about a month, if you're not cooperating, you're not going to get better, and
right.
you're not
Good
going
for
to get
you.
any more
That's
pain
right.
pills.
That's right, Dr. Klein. So it sounds like there's a big care plan that goes into place when your patients come and see you. It's not just pain medication. There's probably OT, PT, quite a bit involved.
Yes. And your
And if
patients
you're
need to
not
be accountable.
compliant, you're not getting any more medicine.
And I think the most important part of what I do is making the patient understand why they will get better if they follow all the instructions.
That's right.
That's more important than the pills.
And I get excited, and I'm going to let you talk, Joe, I promise. But one thing, too, is I think a big part of recovery is also patience, because they are very probably stressed and upset over the pain, obviously, and they're overstimulated. And it's calming down and allowing the healing process to actually take place in a proper way.
Correct.
I think it would be important to have somebody close to them probably go on the visits with them, because sometimes when you're in so much pain, you can't even take it all in, all the instructions that you have for them. It's really important to bring somebody with you. And also that person that's so close to you can see the improvement and how those PMS, signals or symptoms go away as long as they follow your instructions and they're held accountable. And
I think, too, I totally agree having a really proper support system behind you, whether it's family or friends, but I think it's also having a wonderful physician like Dr. Klein, and I think, too, the therapist, because I have gone through PT, through a handbrake, and it's so emotionally, especially on my right hand, my dominant hand, and it was so emotionally stressful and painful. And when I went to PT and OT, I would cry. But they would calm me down, and it was their expertise and telling me I'm going to be fine that helped me. And that's what Dr. Klein said. It's telling you are going to get better. It will get better. So it's pretty powerful. So you brought some props. Tell us a little bit, because I know some of the symptoms that you help with are ear pain, stuffy ear, dizziness, sensitivity to sound, kind of a plethora of symptoms that you treat. So tell us a little bit.
Now, this is something they don't teach in dental school. Dr. Clifton Simmons is president of the Tennessee Dental Association, and last year he called up every single dental school in the country, and he entitled a published article, "Why don't they teach TMD in dental school?" They don't. The problem is physicians say, well, that's TMD, go see your dentist. So it's there. I'm not that smart compared to many other smart people. I
disagree.
Yes.
I just studied differently. So what I had to do after my accident is find out, how does a physician treat a joint? And when you put the medicine and the dentistry together, you get better results. So what I didn't know in dental school, and most physicians don't know because they don't treat TMD, a lot of ENT doctors know this because the ear and the TM joint are right next to each other. When we were all a fetus, we had a little piece of tissue called Meckel's cartilage, from which grew the ear and the TM joint. Now, back when I first got interested in this, I read a ENT textbook that said what I just told you. That was all it said. It said they grow both from the same little piece of tissue, and they confuse each other with their symptoms. That's all they knew back then. What I'm telling you now is mainstream medicine. The ear, and this is a nice model here.
looks like it's from Dumbo, the elephant.
Yes. And I like to explain things visually. So what I tell my patients, in your ear, there's something like a carpenter's level. It's called the eustachian tube. And there's a muscle that attaches to it. Everything we're dealing about here is related to what the muscles do when there's a problem to those muscles. There's a small muscle with a big name, tensor veli palatini. Big name.
And there will be a quiz at the end of the podcast.
When it gets tight, it pulls on the eustachian tube. And if the leveler is off kilter, you get dizzy.
Your balance is off
Your
kilter.
balance is off.
So I have that, just so you know, and I can hear my ears.
Don't fall off that stool now.
Yeah.
I can feel it, and I always think it's sinus related. Like everyone thinks it's inner ear drainage, I always attribute it to a weather change or barometric pressure, but I can literally hear my ears pop, and it's got to cause that because sometimes I will receive dizziness.
It's amazing how many people have this and don't know what it is.
Right.
I don't know. I go right to sinuses, and that's exactly what I have.
I like how you described it by being a carpenter's level, because that makes sense to me. I can relate to that. I come from a father as a carpenter, and my husband.
Carpenter? Yeah.
As a carpenter, right?
Yeah.
You have some nice cabinets at home, I'll bet.
Oh, a beautiful home.
And a deck. And
Yeah, it's gorgeous.
In your ear, there's an eardrum. Couple things happen with TMD. Again, muscles pull on things, right? So there is a muscle that pulls on the eardrum to protect it from loud noises. The eardrum is the tympanic membrane. Tensor tympani is the name of that muscle. When it pulls on it, it protects it. Now, I saw Bob Seger 5 nights in a row many years ago at Pine Knob, and I had muffled hearing. Well, everybody knew, physicians, ENT, they knew, well, your eardrum was
It's
being
exposure
pulled.
to the, yeah.
But that muscle can get tight from a TMJ problem.
Oh, wow.
And so I first got interested in this field. A little 8-year-old girl comes into my office many years ago. She had slowly, over a year and a half, lost her hearing in one ear, her left ear. The ENT doctor at that time, we didn't know about TMD, he said, I don't know what's wrong. Everything looks perfect. Her ear is absolutely anatomically perfect. I don't know why she's losing her hearing. So I looked at this poor little girl, paid no attention to what her parents put down about the ear loss, because I'm a dentist. I didn't know anything about that. I didn't know even how to spell TMJ back then. That was a long time ago.
I feel like you're going to also be, you're a dentist and now you're a pain management, but I feel like you're going to be my forever life coach, Dr. Kine. So just be ready to be my best friend forever. But go ahead. You're welcome. You're welcome.
Thank you. So what I did is I looked in her mouth like a dentist should, and I noticed the previous dentist had extracted a little baby tooth. The upper one, having nothing to bite against, grew down. So I did what any dentist would do. I balanced and evened her bite out. By balancing her bite out, the muscles weren't sore anymore, and her hearing came back.
oh my goodness.
Incredible.
About a month later, the woman comes in with her daughter. She gives me a big, nice cake, and the daughter runs up to me and gives me a hug, and she said, what'd you do? Her hearing came back. I said, I have no idea, but thanks for the cake.
And now you know.
And now I know.
Now you know.
Yeah. And I went to the library, and that's where I got that, what I already told you about, the little piece of tissue, Meckel's cartilage. So basically, the eardrum, when it's pulled on, could make the hearing go away, or it could make you hypersensitive to sounds, which is what happened to me
After the
5
concert.
nights. Yeah.
But it can come back then. It can repair
yeah,
itself.
100. yes.
I stopped seeing Bob Seger for a couple of days, and it went away.
Well, that's a shame.
Nothing personal, Bob Seger. I
Right.
still like you.
Well, and tell us about this prop as well that you have.
Well, a little more though.
Oh, I'm sorry.
The number one symptom, earache.
Oh, yes.
All right. Now, Dr. Travell taught me this. Right here, which is where most people are sore if they have a TMJ problem. When I go inside and press like this, it's sore if you have a TMJ problem. Right here is a trigger point that Dr. Travell found. That trigger point could refer pain into the teeth or into the ear. So when I came back learning that from her, I had a patient who said, Doc, you got to pull this tooth or do a root canal. It really kills me. It's hurting me. I can't sleep. So I did all the tests that any dentist would do, and there was nothing wrong with the tooth. So I felt the cheek. Ooh, felt like a golf ball in there. So I numbed it up with a local anesthetic, which is what Dr. Travell did when President Kennedy was in pain, and his toothache went away. All of my dental friends says, you're crazy. This was a while ago. And that's what they said to Dr. Travell. She was crazy.
Crazy smart.
But it's how it works, just how it works.
That's exactly
Yes.
right.
So otalgia is the name of ear pain, and that is a real common TMJ symptom.
Wow. Wow, this is fascinating. So real quickly, we'll talk about this too. And then actually you worked on our publisher, Karen Smith. So we're going to show what you did because you helped her like almost
Instantly.
immediately. Yeah. So tell us a little bit about this.
Eye problems. There are more ear problems statistically with the TMJ problem, but you can have eye problems also. Blurred vision. How can you get blurred vision from a TMJ problem? Again, we're talking muscles. If you look at this, look at all the muscles that are around the eye.
It's incredible.
I will say this muscle only. both of you just look straight ahead at the camera. Now, look, without moving your head, look at this. Your eyes moved in that direction, right? So what happened is the brain says to you, this muscle, pull that way. This muscle, the lateral oblique, pull this way. And you look that way.
We did it.
Like a ping pong match, you know, you're going
Right.
without moving your head. If these muscles all get tight at one time, it's blurry.
Oh.
So
okay.
blurred vision that comes and goes, not blurred vision constantly, is a TMJ situation.
And that's so interesting. It's a really, I think, important point you brought up. Blurred vision that come and goes, something that come and goes, we will not
Go get it checked
no,
out because
we
it's
are
not
like it's
consistent.
gone. It's gone. So something that's intermittent, right, could be a TMJ problem.
Could be, yes.
Very fascinating. So
Yes.
real quickly, because we don't have a lot of time left, and you're coming back on because we adore the ground you walk on. Karen Smith, if you could come up and if you could show us real quickly for our viewers and our listeners what her issue was and how you treated it.
Well, I began to treat it.
Well,
Yeah.
She still needs
that's
to work.
right.
I'm gonna come to the office.
The
We'll just bring
magic,
this for
right? Yes.
So-
viewers.
Tell me the symptoms you were talking about. You're talking about itchy ear and some pain.
Yeah, just ears always itching, and I didn't even realize until you put the glove in there and and massaged it a little, and I'm like,
And you had
wow,
loss of
okay.
balance a little bit?
Yes,
Okay.
dizziness, and and I'm thinking I'm doing something to my equilibrium in my ear or something, and
So she
maybe
had
I
heard,
shouldn't be itching it with this high pressure water. That's
and you had heard me talk about, before we did this little
Yes,
podcast.
yeah.
So I put a glove on and I just went like this and said, does that hurt? And it's not supposed to hurt. It's not supposed to hurt. Does this hurt? No. It should feel the same here, and I'm not going to go in I'm not trying to hurt her. But so what
Don't
I
hurt
did
my boss.
is I put the glove on, and I went up here. You see where my thumb is coming out a little bit? And I grabbed it, and I'm pretending I'm making pierogies.
Oh,
I'm
good
massaging
analogy.
it, and I pulled it down, and I pulled it forward. And what I'm doing there is just taking that Charlie horse, that tight muscle, and
And that's
relaxing
exactly
a little
what
bit.
it felt like
And
when he was
we-
pulling on it. And after the massaging of it, it was unbelievable. It feels so much better.
Different. And
So
a
I
lot
will
of
be making an appointment.
and
definitely.
you're coming back on the show and we'll talk more. I mean, there's so much to explore about this, but it's also stress related. There's also massive stress associated with a lot of these symptoms. So when we have you back on, we'll talk about stress and stress management and just everything
How
because
important it is to get
and
sleep
h-
too.
and how you take the best of Eastern and the best of Western and you marry them
Mm-hmm.
and how you treat the holistic side and just how amazing you are. And I love too, don't you, Joe, like you said, being a dentist, you probably had no idea the trajectory of your life and now changing people's lives. Must be pretty incredible and special for you.
I'm happier with God now, and I've always loved God, always believed Him. But yes, He had a different plan for me, and I'm so happy.
And
He
we're
does for all
happy
of
too.
us, yes.
And we're happy too. We're very grateful for that as well. So, Dr. Klein, real quickly, what is your website?
My website is michiganheadandneck.com.
Excellent. And your phone number?
586-573-0438.
Excellent. Dr. Richard Klein, thank you so much for being
you.
on the podcast.
Thank you so
Absolutely amazing. We can't wait to have you back on. Big thank you to my beautiful co-host, Joe McAllister. And a big thank you to our patient, publisher of Innovative Health magazine, Karen Smith. And big thank you to our viewers and listeners. You've been watching and listening to Innovative Health Podcast.